From our Abuja studios in Nigeria, welcome to News Bits. I am Grace Ukot. This is a special report and it concerns Nigeria recording its first mortality case of influenza A virus, otherwise called swine flu, which broke out in March 2009. Health Minister Professor Babatunde Oshotimehin has recently disclosed the first mortality case of swine flu in Nigeria. The case is of a 38-year-old female in Lagos who tested positive to H1N1.
We've had one mortality, somebody who's died from it. She, visited the United States about 3 months ago, came back, and then fell ill about 6 weeks ago and died from it. But that's the only one that we have absolute confirmation. There was another one that appears to be, but the event occurred before our attention was called to it. So it's presumptive, but one definitive death.
The minister also disclosed that the country had recorded 11 laboratory-confirmed cases of the virus, including the fatal case.
The hospital in Lagos, for instance, where this has occurred, we've been working with them. We've tested everybody that has made contact with that patient, and we are satisfied that nobody, is in danger immediately. So.
We take opinions of some Nigerians on their knowledge of swine flu and how much they know on taking precautions now that a fatality has just been recorded and 10 other people have tested positive.
Swine flu is what is it's one of the flu that is spreading around the country these days. It's as a result of the flu, that is the virus that that attack the swine where they store them, where they rear them. There is out of negligence, out of carelessness that this virus spread across. I believe what can be done to eliminate these kinds of flu is by cleaning the affected ones or by treating them. There is a vaccine that can be used to treat such affected swine. The symptom is such a swine will lose appetite to food, and at the same time they will be dulled and sleeping around instead of walking around with their colleagues. They will be sleeping and be hiding.
From what I heard from news, it started from Mexico, bordering American border. It's some kind of virus that occurred from the pig, swine, if you call it. And it's a new thing, it's not common. And that's all I can say about it so far. They call it H1N1. What I read about the symptom is that you will notice the person could be sleeping or weak, kind of, and start exhibiting an uncommon kind of something that is higher than the normal fever you think about.
While Femi and Peter seem to have fair knowledge on swine flu, some other people appear to be ignorant of the virus.
Have you heard of swine flu?
Yeah, I've heard about it.
So what do you know about it?
I don't know.
You don't know anything about it?
I don't know.
You don't know the symptoms?
Yeah, I know the symptoms. At least the adverts on TV sometimes okay, when you have cold and catarrh, you don't expose yourself to, you don't come to where people are, things like that.
And are you aware that a death has been recorded in Nigeria?
No.
You're not? No.
The symptoms are maybe swollen legs, hands, faces, and all those ones. And the person will look like a pig and behave like a pig. Something like that.
Okay.
Yeah.
Are you aware of a death being recorded in Nigeria?
About swine flu?
Yes.
Yeah, I think so. I've been hearing it, but I've not been taking notes of it to quote the exact percentage or number of people that it has affected.
Well, it appears that none of those tested positive to swine flu was reported to have behaved like a pig. Meanwhile, the health minister mentioned what to expect as symptoms and possible ways of avoiding the virus. He also mentioned how far his ministry has gone in sensitizing the public on the H1N1 virus.
We tried our best, but you also must contextualize this. When you look at the burden of malaria, you look at the burden of HIV and all of that, this is not one which is big. So, but we continue because it's something which we have a definite position about what to do, and we continue to educate Nigerians about it. Incidentally, there was a private sector organization that Reki Benkitza that is helping us in this mobilization, and they've helped us considerably in terms of radio announcements and television announcements. And only recently, WHO has offered us, I think, 30 million doses of vaccine. So we're going to also offer that to those who we think are vulnerable.
So can you just remind us of symptoms too?
Symptoms, and that's where sometimes it's difficult. Symptoms are very, very, very similar to the flu. Headaches, a runny nose, some fever, maybe a slight sore throat. It's very similar. But what characterizes this is that it does not go away. If it's a serious infection, it doesn't go away like the flu goes away. And then you start getting some compromisation of your breathing and all. And it's at that point that you need to actually do something critical about it.
And possible ways of preventing contact?
Preventing, it's very easy. Be very clear, stand away from people who are coughing. And avoid crowded places. Because, the transmission is then very easy. And these were the kinds of lessons we gave to our pilgrims who went to the Arch this year. And we were very happy that they all came back. Maybe one or two of them had an infection, but it wasn't a problem with those who went on pilgrimage. So the hallmark of it is avoid crowded places. Stand away from somebody who's coughing. And if you have a cough, make sure that you cover your mouth when you cough so that you do not transmit it to other people.
After Mexico, where the H1N1 virus broke out, fatality cases have been recorded in the United Kingdom and United States since last year. This being Nigeria's first case reiterates the need for Nigerians to be more aware of symptoms and be cautious, especially when they travel to countries with recorded fatalities. That will be all for now. Updates as events unfold. Thanks for logging on.